Hey, everybody. Welcome to Meddkit's Provider Spotlight, where we are interviewing the most interesting and fantastic practices and physicians all over the United States. And today we have a really awesome guest, Dr. Lucariello for Waccamaw Dermatology. Is here with us and has definitely a lot to say about the field of dermatology and what he has going on. So welcome, Dr. Lucariello.
Oh, thank you so much for having me.
Yeah, excited to kind of dive in. And so would love to hear a little bit about your story. What inspired you to practice dermatology?
So my name's Rich Lucariello. I'm a board certified dermatologist at Waccamaw Dermatology in Myrtle Beach, South Carolina. I think that the story kind of begins like what inspired you to go into medicine. And I know it sounds kind of cliche, but I think, helping people is like the core thing, which I'm sure other people have said before. What kind of drew me to dermatology? There's a lot of different reasons, but I would say the thing that drew me most to it was really like the management of skin cancer, like prevention and treatment of skin cancer. That's primarily what I focus on in my practice. Besides that, I do a lot of what we call like medical dermatology, which would be kind of like besides the skin cancer prevention and treatment, more of like rashes, I guess you would say, like management of like acne, eczema, psoriasis, to name some of the common ones.
It's, really interesting. And I find that, a lot of things that you mentioned, there's a lot of people that struggle with some of the, psoriasis and how, you know, it's so difficult sometimes to treat. And it's really great that, it seems like you're so passionate and down to help folks get through, these rough patches or, may come in the office with a certain concern. And so I think people are treated the best when passion is number one, especially in helping people.
I completely agree.
Awesome. And so, how would you say that your skincare approach is different? What kind of makes seeing you a little bit different than maybe other dermatologists? And what is the key for you for your great results?
So I think that there's some things in general that are just important in general. I think you actually hit on one of them, like passion. I always tell people, like, I think you really have to be passionate about what you're doing, regardless of what it is, whether it's dermatology or something else in medicine, or really any career. I think that the people who are the best at what they do are passionate about what they do. I think the other thing that helps me, and I think that this is probably, a lot of people, I feel like I was really well trained. I trained at the Medical University of South Carolina down in Charleston, which is the only program in the state, so at a major academic medical center. So I was really exposed to a lot of different stuff. As far as like me specifically, I really try to tailor my approach to like the individual patient. Like a lot of this stuff is similar patient to patient, but everyone's kind of unique as far as like how they think about things and what they're concerned about. And I think kind of, hitting on that really, helps distinguish me a little bit, from maybe some of the other providers.
No, exactly. I love that. And what do you wish people knew about the field of dermatology? Maybe there's some things on the medical front or cosmetic front that maybe are confusing, or maybe there's some total misconceptions. Do you ever find that you walk in an office and you're seeing a patient and they start telling you about, what they found on Google and, they're utilizing maybe ChatGPT or other things to kind of solve their skin problems. What do you kind of say to that?
The internet's always tricky with stuff like that. There's a lot of information out there. Some of it's probably good information, some of it not so much and everything. And I think that while the internet has a lot of valuable resources too, I do find that it does stress people out. Like people Google all kinds of stuff, and they get really stressed out about it and stuff too, because they tell you have something really bad or really serious, which can sometimes be the case, but not always and stuff. As far as like misconceptions, dermatology is like a really diverse field. So like I focus primarily on like medical and general dermatology. I'm not sure about like, I think probably there's more misconceptions in the cosmetic realm and stuff that, you know, it's not really something you have to do, I guess. So, but I still think that they help people, even though some people, at least within the field of dermatology, that some people might have the notion that they're not really practicing true medicine. I don't really do that myself anymore, even though I was trained to. It's not something I'm as passionate about, but I still think they're still helping people. I think that a lot of the appearance related stuff can definitely affect people's self-esteem. And, I think that stuff's important in its own way. We have other great providers in our practice who handle more of those issues, who I usually send patients to for
Yeah.
stuff like Botox and filler and laser treatments and stuff along those lines.
Sure, absolutely. And, kind of touching base maybe on the medical side then, do you have a lot of, what are just some of those like difficult cases or maybe, talking a little bit more about those misconceptions that people might have when they come in the door, may not know what to expect.
On the medical side, like really a lot of the stuff that used to be challenging, and this has even changed in like the last 5 years, and I finished training 3 years ago. There's been a lot of like new breakthroughs in as far as like some of the inflammatory dermatoses or the rashes, particularly like eczema and psoriasis. People with really mild cases always did very well because there's been topical creams or creams you can use that work very well for that. But there used to be a major struggle with people who had like really substantial, like half their body's covered or 80% covered, particularly with like eczema and psoriasis, I would say specifically. And just some of the new injectable medicines, a lot of people have probably seen them advertised on TV. They really work exceptionally well, honestly, and they've made my job a lot easier. They're very well tolerated. The side effects are usually pretty good, and usually there aren't too many issues with that. And they really work exceptionally well, honestly. When people come in, I usually have tremendous confidence that we're going to get a really good result with that stuff. It's really uncommon now that we're not able to kind of address that and get a satisfaction, if not 100% gone. We usually get the overwhelming majority gone when people are, much better off than before and generally happy with how they're doing and everything.
That's awesome to hear. I personally know a ton of people that, deal with psoriasis, and it can be one of those pesky, things to, be difficult to get rid of, but it's actually great to hear that there's so much improvement on all the different, between the injections, but it's great to hear for mild cases that topical creams are definitely, a really great route and has really made that clear up. Is there anything else that you could say about the research in, you know, psoriasis or any of those type of like-minded skin conditions that have been improved over the past few years?
Besides psoriasis, I would say eczema. One of the first medicine was Dupixent, which is actually used for other conditions outside of dermatology too. Like I believe it's used in asthma and other stuff, which it works well for. And that's really revolutionized like the eczema treatment. There's been some additional therapies that have come along after that. It's very uncommon nowadays for me not to get a good result with both of those conditions because of that. Probably the other area that there's been a lot of like real growth in and stuff, and it's been a little longer than 5 years, would be like melanoma treatment, which is like generally the most serious type of skin cancer. Previously when they spread outside of the skin, before these medicines called immune checkpoint stimulators or medicines that stimulate the immune system, it usually was a very grim situation, when someone had something like melanoma that spread to like, let's say a lung, for example. And there's really been a lot of breakthroughs in that too, where people do really, really well. One of the, well-known medicines or one of the first ones that came out that works like that would be this medicine called Keytruda, which people might have heard of too. And it's also used for a lot of other cancers too, which it's shown a lot of promise in. So I think that's probably one of the other main areas that's really been, greatly benefited by innovation and stuff too. Besides like the eczema psoriasis, I mean eczema and psoriasis, I would also say like melanoma treatments have really been revolutionized. And they're also working for similar treatments for some of the lower grade skin cancers or the non-melanoma ones, which, usually they don't get as serious, although they definitely can if they spread to a lymph node. And they're also, coming out with new treatments for that, which is actually in the last couple of years, I would say.
That's awesome. Yeah, I was going to ask about, different modalities or other things that you're using, in your practice to help patients along. And it's great to hear that, maybe you do have something a little serious going on or something that's difficult to get rid of, but there's so many different treatments out there that it's not like you're you can't fix it. There's nothing else to be done. So it's great to hear that there's so much more research being done and so many different options that your patients have um, to heal and to get rid of some of these skin conditions or cancerous conditions as well.
No, absolutely, absolutely. I couldn't agree more.
That's awesome. And is there a few easy tips, kind of staying still on the medical side, that you might suggest to people, everyday folks that would work for them in bettering their skin habits? Anything that you can do or should do on a daily basis that you think would improve the longevity of their skin or keeping it safe, protected? Is there anything that you recommend every day or something small that someone can do now to make that transition to better themselves?
So there's really two main things that I would say for that. As if you get older, your skin does change and it does age. And there's really, unfortunately, that happens to everyone. And there's not, you can't really do anything about getting older, unfortunately. But the two things that like I think are the most helpful and they're easy to do and they definitely slow down skin age. And one would be like being good with sunscreen and sun protection in general. Getting a lot of sun definitely is a photo ager or causes the premature aging of skin. And what I recommend for my patients is like to use a broad spectrum sunscreen. At the very minimum, I would do it when you're going to be outside a lot, like in summer months, if you live somewhere tropical. If you're going to really be outside, I would say, by broad spectrum, I'd say at SPF of greater than 30. Generally sunscreens with a lot of mineral blockers like zinc and titanium oxide, which kind of give it that white pasty
Yeah.
consistency, tend to be better as far as sun protection, even though they're not the most pleasant sometimes as far as like consistency and feel. Some of my patients don't care for that aspect of it. And really, you want to do it every hour and a half to 2 hours if you're going to really be out all day. In a perfect world, you would wear it every day, even when you get in the car in the morning, I don't think that that's always the most practical thing, although that would be like the recommended thing. And that's generally for people 6 months or older. The American Academy in Pediatrics and American Academy of Dermatology don't recommend sunscreen use for, infants under the age of 6 months. At that age, you would want to do more of like physical protection, which would be like keeping the baby under the umbrella and like wearing a hat and stuff like that. But for anyone over 6 months plus, I would say to do that every day. The other thing that I think really ages the skin that's preventable would be smoking, like tobacco, cigarettes, stuff like that. Everyone knows it's really not good for your health overall, and it causes a whole bunch of different health issues. But I definitely think it's one of the main things that ages your skin also. And I think those are like the two things that are like easy to do, and definitely make a huge difference without having to go out and get a bunch of different products and all this stuff like that. I think those are like the two simplest things to do that really make, honestly, they probably make the biggest difference more than all the products you can go out and get.
That's amazing. And I love how down to earth you are about it. Because, there's some people that just, they're exhausted at the end of the day or the beginning of their day. And not all the time do they have a great routine and they're lathering themselves up with, 5 to 6 different products a day. But I like, definitely when you're going to be out in the sun and what type of sunscreen is the best. And that's really cool to hear that about the zinc. And, even if it is a little bit whiter, it's probably going to perform a little bit better. So it's good to know about reapplication. And I think this is a great topic that you bring up, especially heading in the summer months. It's May and we're getting a lot warmer out. People are going to be going to the beach pretty soon. And so I know the new moms are going to be bringing their toddlers along. So that's some really great advice for those young families that are looking to keep their kids safe this summer.
Yeah, absolutely.
Awesome. Well, I really appreciate your time, this interview. I think you gave us a lot to think about. I really appreciate everything that you've said. Is there anything else that you'd like to add? And better yet, is there something that you can leave folks with? They might want to get in touch with you or they might want to reach out to make an appointment. Can you tell everyone how to do that?
Yes, there's a few ways that you can look us up. You can go to waccamawdermatology.com and there's a bunch of information about how to schedule an appointment there. I mean, we also have a Facebook and Instagram page. You can also find us there as well.
Terrific. Well, appreciate everything and thank you so much again and hope to have you on again soon.
No, absolutely. Thank you so much for having me. It was a pleasure and have a good day.
You too.